Welcome to the Deep Dive. Today, we're stepping into a topic that really touches so many lives, but one we often find difficult to talk about.
Hmm.
It's about recognizing those, well, subtle signs that an elderly person might be nearing the end of their life. It's definitely a sensitive subject.
It really is. But clarity here can make such a difference.
Yeah,
There's this common idea that decline in older age is quite sudden, maybe linked to a specific illness or an event.
right, like a fall or something.
Exactly. But the material we've been looking at, it suggests something different. It shows how the body often starts sending these quiet signals, easily missed ones.
Quiet warnings.
Yeah, months, sometimes even a full year before the really final stages.
Okay, so our source for this deep dive today is a transcript from a YouTube video. It's called 5 Signs An Elderly Person May Be in Their Final Year. Subtle warnings you shouldn't ignore.
Hmm.
And it basically lays out these key indicators that it argues often get overlooked, which can leave families feeling, well, unprepared when the time comes.
And that unpreparedness, it just adds so much extra difficulty, doesn't it, to an already really challenging time.
Absolutely.
So our mission today, kind of drawing from the insights in this video transcript, is to unpack these 5 potential signs.
Yeah.
And the goal isn't, to create fear or anxiety. It's more about what the video suggests, empowering people with knowledge.
Right. Understanding these changes isn't about dreading what might be coming.
Exactly. It's about being prepared, emotionally, practically, so you can maybe provide better care, make the most of the time you have, those meaningful moments.
And help ensure that final phase of life is, well, approached with comfort, dignity, and peace. That's the hope, isn't it?
That's absolutely the hope.
Okay, let's unpack this material together then. Let's see what we can learn from these potential quiet warnings. What's the first sign the source highlights?
So the video describes significant weight loss. It calls it one of the earliest and most telling signs.
Okay, significant weight loss.
But it emphasizes it's often really subtle, especially at the start. Like maybe you just notice a belt needs tightening another notch.
Or clothes just seem a bit looser than before.
Yeah, exactly. Or just a general kind of fading of interest in food. Appetite isn't quite there.
And I imagine it's so easy to just brush that off, right, as, oh, well, they're just getting older.
That's the common reaction, and it's something this source really pushes back against. It states pretty clearly that unintentional weight loss, so losing weight without actually trying to, is rarely just a harmless part of aging.
Okay, so it's often a stronger indicator.
Yes, a strong indicator that the body's fundamental processes are changing.
Like how it absorbs nutrients, maybe.
Yes, that's a key point the video makes.
Yeah.
The body might not be absorbing nutrients as efficiently anymore.
Mm-hmm.
And you also see a decrease in muscle mass, sometimes called muscle wasting. Essential systems are just starting to slow down.
So the body might struggle to digest food properly or use protein effectively.
Right. And protein is so vital for maintaining muscle.
And the impact of losing that weight, losing that muscle, it goes way beyond just how someone looks.
Oh, absolutely. That loss of strength, it makes someone much more vulnerable.
How so?
Well, it significantly increases the risk of falls, for one,
Yeah.
and it weakens the immune system, leaving them much more susceptible to infections.
Right. The source also talks about changes in appetite itself, not just eating less because they don't feel hungry, but something deeper.
Yes, a physiological shift. It mentions the sense of taste might fade, which makes food less appealing naturally.
Which leads to skipping meals or smaller portions.
Exactly. But the material frames this as the body itself kind of sensing it's entering a shutdown phase.
Wow.
And it starts signaling the brain for food less often. It's less about conscious desire and more about the body's internal messaging changing.
Which, predictably, I guess, leads to less energy, less strength, feeding into that overall gradual decline.
Mm-hmm.
And the source points out that weight loss is often a symptom of underlying chronic conditions too, right?
Very often. Things like cancer, heart failure, kidney disease, even depression or cognitive decline.
Conditions that might be progressing quietly before other symptoms become obvious.
Precisely. And these conditions can contribute to that weight loss early on, creating this kind of downward spiral where the body just isn't getting enough fuel to maintain itself.
It's so natural for families, for loved ones, to try and fight this, isn't it? To encourage more eating, bring their favorite foods, try nutritional supplements.
It's a completely understandable and loving response, but the source makes a really crucial point here.
Which is?
If the weight continues to drop despite all those efforts, It likely indicates a deeper transition is happening.
Uh,
And at that point, trying to force large meals might not only be ineffective, it could actually cause discomfort.
okay, so what's the suggestion then?
The insight offered is that the focus often needs to shift away from strict nutritional goals and more towards comfort.
Comfort, like easy-to-eat foods.
Yes, easy to eat things, maybe softer foods, and just ensuring they stay hydrated. That becomes the priority.
So recognizing significant weight loss isn't just about seeing someone get thinner. It's about understanding, like the source suggests, that the body is communicating something really profound.
Mm-hmm.
And having that understanding can help you approach this situation with more clarity, maybe more compassion, and really focus on what matters most, making those remaining moments meaningful.
Exactly. And building on that physical decline, the second sign the source discusses is extreme fatigue and weakness.
Okay, extreme fatigue. And this isn't just feeling a bit tired, right?
No, not at all. The material emphasizes this as a deep, persistent exhaustion, the kind that isn't really relieved by sleep or rest.
Wow.
And it's something that often emerges, the source says, in that year leading up to the end of life. It's described as profound, overwhelming fatigue.
So overwhelming that it makes simple, everyday tasks feel huge.
Immense efforts, yeah. Getting out of bed, walking across the room, cooking a simple meal, even just getting dressed or holding a conversation, it can all become incredibly difficult.
And the source is careful to separate this from just, normal tiredness that comes with age.
Yes, it sees this level of fatigue as a sign that the body is actively conserving its very limited energy because organ function is slowing down significantly.
Because the heart's pumping less efficiently, circulation weakens, muscles aren't getting enough oxygen. It all connects.
It all connects, yes.
Yeah.
Which contributes to that feeling of being weak, unsteady, and just genuinely unable to keep up previous levels of activity. The source uses the term metabolic slowdown.
Ah, right. So the body's essentially redirecting energy away from movement and towards just preservation
That's the idea, and that's why you might observe someone sleeping for much longer stretches.
or needing lots of naps.
Frequent or really long naps, yeah. Finding it hard to stay awake for long periods or having these sudden, unpredictable energy crashes, they seem okay one minute and then just completely drain the next.
The emotional toll of that must be huge for the person experiencing it and for their family watching. The source mentions the frustration, maybe embarrassment, about losing independence.
It's incredibly challenging, both to live through and to witness. The source notes that people might start to withdraw from conversations, social activities, hobbies they used to love.
And it stresses this isn't because they don't care anymore.
No, it's crucial to understand that. It's usually not a lack of interest or affection. It's purely a lack of physical energy.
But that withdrawal can then lead to isolation, right? Which could potentially speed things up further.
Sadly, yes, it can become a cycle.
And from the family's point of view, it must be easy to misinterpret this exhaustion, to think, oh, maybe they're just being lazy or, they just need to push through it.
That's a common thought, but the source specifically advises against it. It really emphasizes that trying to force activity or push through this kind of fatigue at this stage, it just won't help. It could even be detrimental.
So what does the material suggest is most important then?
Understanding their limits, allowing them the rest they clearly need, and focusing efforts on making their days as comfortable and peaceful as possible.
Okay, so the key takeaway for this sign, this ongoing deep fatigue,
Mm-hmm.
it's recognizing it as a signal of a major transition happening.
Mm-hmm.
It means shifting expectations, maybe prioritizing just being present, cherishing quieter moments, offering support without pressure for them to do things like they used to.
Exactly. The insight here is that ultimately, what matters most isn't how much they can do anymore, but ensuring they feel loved, understood, and just at ease.
Okay. Moving on from the purely physical signs, the third key indicator discussed in the material is cognitive confusion or withdrawal.
Right. This involves noticeable changes in how someone thinks, communicates, and interacts with the world around them.
So what kind of changes are we talking about here? What does the source describe?
Well, it lists things like forgetting things much more often than usual, struggling to follow conversations, even simple ones.
Getting disoriented.
Yeah, seeming disoriented even in places they know really well, repeating the same questions or stories over and over, forgetting names or what day it is.
And the source points out this can start happening even if someone didn't have major memory problems before.
That's a key point. These changes can begin subtly, months, maybe even a year before death, even without a history of dementia, for example.
So not necessarily a sudden dramatic shift, but a definite increase or worsening of forgetfulness or confusion. And the video explains why this might happen physiologically.
It does. It explains that our brains need a constant, steady supply of oxygen and nutrients to function well.
Okay.
And as circulation weakens, which links back to those earlier physical signs we talked about, and that supply of oxygen decreases, cognitive function naturally starts to decline.
Which leads to that confusion, difficulty making decisions, maybe trouble recognizing people or places.
Exactly. And the source mentions something many families notice: these moments of surprising clarity, followed quite quickly by sudden confusion again.
Like the mind is fading in and out.
That's exactly how the source describes it, yeah, fading in and out.
And there's also the emotional withdrawal aspect the source discusses.
Right. Losing interest in social interactions, maybe speaking less, engaging less, just spending more time in silence.
And again, the source is clear. This isn't necessarily because they don't care anymore.
No, it emphasizes that. It's often because the brain is processing emotions and the sheer effort of engagement differently.
Conversations become tiring. Loud environments overwhelming.
Yes, exactly. So they might retreat into their own internal world simply because it's less demanding, less taxing.
The source also mentions possible shifts in mood or behavior.
It does. Becoming perhaps more irritable, anxious, or easily frustrated. Or sometimes the opposite, becoming unusually calm, detached, almost indifferent.
And this isn't just a personality change.
The source frames it more as the brain adjusting to the body's overall decline. Expressing emotions might become harder, and they might react less strongly to things happening around them.
For families, this particular sign, the cognitive changes, the withdrawal, it can be incredibly painful, can't it? It can feel like you're sort of losing the person you knew even before they're physically gone.
It's one of the hardest aspects, absolutely. But the source offers a really important perspective here.
What's that?
It emphasizes that these changes are not something the person can control. They aren't doing it deliberately.
So the best approach isn't trying to force them back to their old self.
No. The source suggests it's about meeting them where they are, in that moment, speaking gently, offering simple reassurance, just being present.
Even if they don't always respond.
Even then, the source includes a really touching thought. They can often still feel your presence, feel your love, even if they can't always show it or respond in the way they used to.
That's important to remember. So if you're noticing a significant increase in forgetfulness or confusion or social withdrawal, the source strongly advises not to ignore it.
Right. These are often early indicators that the body and mind are preparing for a major shift.
And it calls for patience.
A great deal of patience, yes. And cherishing those quiet moments together, trying to create a safe, familiar, peaceful environment for them.
The message seems to be that even when words fade, that connection, that love and comfort remain profoundly important and can still be felt.
Absolutely.
Okay, moving on. The fourth sign detailed in the material relates more directly to the body's defense system: frequent infections and slow healing.
This is presented as a pretty clear physical sign that the immune system is weakening.
So the pattern changes. Someone who is rarely sick might start catching every cold, every flu bug going around.
Exactly. Or minor illnesses just seem to take much, much longer to recover from. Even small cuts or bruises heal at a noticeably slower pace.
Because the body just isn't as good at defending itself or repairing damage anymore.
Precisely. It's less able to fight off invaders, less able to mend tissues. And so repeated infections become a really significant concern.
What kind of infections does the source mention specifically?
It lists things like pneumonia, urinary tract infections, UTIs, skin infections, even oral infections like thrush as becoming much more common. It's the body losing its ability to effectively fight back.
And the material also suggests that even standard treatments like antibiotics might not work as well.
That's right. The person might need stronger doses or take the medication for longer or even need multiple rounds of antibiotics for infections that previously would have cleared up quite easily.
Why is that?
It links back again to slowing circulation and declining organ function. The body just doesn't respond to the medication as effectively as it used to.
The source also highlights the issue of chronic wounds, doesn't it? Things like scratches or sores that just don't heal properly.
Yes, or they seem to heal and then reopen easily. This points directly to compromised circulation.
Because poor blood flow means less oxygen and nutrients getting to the tissues.
Exactly, which dramatically slows down the whole healing process. And this significantly increases the risk of developing pressure sores, especially for people who aren't moving around much.
And those sores can become really serious, leading to dangerous infections.
They can, yes. Now, here's where the source provides a really critical insight. particularly about infections in older adults who are nearing the end of life.
Yeah, what's that?
It makes a very important point. Infections in this final year often don't present with the classic symptoms we usually expect, like a high fever.
That is vital information, because families might miss the signs if they're only looking for a temperature spike.
Absolutely.
So what does the source suggest might be the first warning sign of an infection instead?
Often, according to the source, the very first sign can be a sudden, unexplained decline in mental alertness.
Like increased confusion.
Or lethargy.
Yes, increased confusion, unusual sleepiness or lethargy, maybe a sudden lack of interest in eating or drinking. Recognizing that subtle shift can be key.
Which brings us back again to the importance of noticing those subtle changes early. Dealing with recurrent infections must be incredibly difficult and frustrating for families.
It really is. And the source acknowledges that natural impulse, that urge to push for aggressive medical treatments. More powerful antibiotics, maybe hospital stays, trying to cure the infection.
It's completely understandable, but the video suggests there comes a point where a different focus might actually be more beneficial.
A shift in focus.
Exactly. A shift from trying to cure at all costs towards prioritizing comfort.
How so?
The source posits that at this stage, simple measures like ensuring they're well hydrated, keeping their skin clean and cared for, and minimizing unnecessary stress on the body. These things can often do more for the person's actual well-being than aggressive medications that might just prolong suffering without really improving their quality of life.
So, recognizing frequent infections, slow healing, and especially being aware of those non-traditional signs like mental changes, it helps families and caregivers figure out the most compassionate path forward.
Yes, a path focused on comfort and support. It reinforces that idea that sometimes, for overall well-being, the goal needs to shift away from attempting a cure and towards providing comfort.
Okay. And finally, the fifth sign outlined in this material. This relates to major changes in breathing or circulation.
These are often seen as some of the most telling indicators that the body is preparing for its final stage.
What kind of breathing changes does the source describe?
It talks about breathing potentially becoming slower or perhaps shallower, noticing pauses between breaths.
Pauses?
Yes, sometimes noticeable pauses. Or irregular patterns, maybe breathing speeds up for a bit, then slows right down. It specifically mentions Cheyne-Stokes respiration.
Which is that distinct pattern, right? Alternating deep, rapid breaths and then longer pauses.
That's the one. The material notes that while these changes might start subtly, they tend to become more pronounced and more frequent over time.
And alongside the breathing changes, shifts in circulation.
Right. Weakened circulation is another key indicator mentioned. You might notice that the hands, feet, maybe the nose or ears feel quite cool to the touch.
And the skin might change appearance.
Yes, it can sometimes take on a pale look or bluish or even a mottled patchy appearance. This is often most noticeable in the fingers and toes.
And the reason for that coolness, that discoloration,
It's the body prioritizing. It's directing the remaining blood flow towards the vital organs, the brain, the heart, the lungs. So circulation to the extremities, the arms and legs, gets reduced.
it's a very clear physical sign that the heart's pumping less strongly and the whole system is conserving its resources. The source also mentions an increase in shortness of breath, even with very little effort.
Yes, even minimal physical movement, like just sitting up in bed or speaking a few sentences or shifting position slightly, might leave someone feeling winded, out of breath.
They might start breathing through their mouth more or need to stop talking to catch their breath.
Exactly. These indicate declining lung function and just overall decreased capacity.
And the source describes fluid buildup in the lungs as well. What does that look like?
Well, it can manifest as a persistent cough. Sometimes you might hear gurgling sounds in the chest, or the person might complain of a feeling of tightness.
And this isn't just like a regular cold or congestion.
The source clarifies it's often a sign the lungs themselves are weakening, becoming less efficient at clearing fluids. And this can make lying flat really uncomfortable.
Which is why someone might prefer to sleep propped up on pillows.
That's often the case, yes.
Seeing these changes, especially the breathing changes, that must be incredibly frightening for families watching. There's such a natural instinct to want to intervene, to fix it somehow.
Oh, definitely. To encourage deeper breaths, to worry that something acutely urgent is happening right that second.
It's a very understandable reaction.
It is, but the source offers some reassurance here. It suggests that these breathing and circulation changes are often the body's natural way of slowing down, part of the dying process itself.
So trying to reverse them might not be possible, or even the right goal.
Exactly. Attempting to reverse them might not be possible, and the focus shifts decisively towards comfort measures instead.
What kind of comfort measures?
Things like keeping the room cool and well ventilated, using a humidifier might help, offering small sips of water. Sometimes specific medications or even low-flow oxygen can be used. But the goal isn't to reverse the process. It's purely to ease any discomfort associated with it.
So the shift is really towards easing symptoms, not fixing the underlying issue.
Precisely.
So for the listener, paying attention to those changes, the breathing patterns, the cold hands and feet, the skin discoloration, these are strong indicators. The body is significantly conserving energy. Circulation is slowing right down. And the material frames this time as one where the most important thing you can do is just be present, offer reassurance, create a peaceful, calm environment.
Yes. It really underscores that in these final stages, the most meaningful contributions are often not the high-tech medical interventions aimed at curing, but rather providing that essential comfort, maintaining dignity, and ensuring the person knows they are not alone and that they are deeply loved.
So drawing all that together from the video we explored,
Mm-hmm.
we've covered these 5 potential signs.
Significant weight loss, that extreme fatigue and weakness, the cognitive confusion or withdrawal, frequent infections, and slow healing, and finally, those major changes in breathing or circulation.
And a source emphasizes these signs, often starts subtly, maybe appearing over the course of that final year, not necessarily all at once.
Right, they're presented more as cumulative indicators that the body is entering its final transition phase.
And it's just so natural, isn't it? Driven by love, by hope,
Yeah.
to want to resist these changes, to try and push for more eating, more activity, encourage someone to fight the exhaustion.
That's a deeply human response.
But as this deep dive into the material has shown us, there's a really powerful perspective offered here. That sometimes the most compassionate, the most helpful thing we can do is to actually listen to what the body is communicating
Yeah.
and shift the focus away from trying to reverse what might be inevitable and towards making the time that remains as peaceful, as comfortable, and as filled with meaning as possible.
Exactly. Understanding these potential signs, it isn't really about fearing death, it's more about being prepared.
Prepared in a way that allows for clearer thinking,
Yeah.
better decision-making.
Yes, and more thoughtful care. It enables you to truly cherish the time that's left. It becomes a period focused more on connection, on sharing stories, on ensuring dignity right to the very end.
If you are noticing some of these signs in someone you care deeply about, know that you are navigating a profoundly human experience. And you're definitely not alone on this path. It's never easy. But having some understanding of what might potentially be expected, like the insights outlined in this material, it can perhaps help you find moments of strength, patience, and maybe even a measure of peace amidst the undoubted difficulty.
Well said. And perhaps here's something to consider as you reflect on this deep dive we've taken today.
Okay.
How does thinking about these potential subtle signs, maybe recognizing them earlier, how might that change the way you choose to prioritize your time and your interactions with the elderly people in your life, starting right now?